Hello everyone, today this is the very first video of pediatrics and we are going to discuss about the basics of pediatrics, general pediatrics, and the first topic here is going to be growth and development. So the first topic that we are going to discuss is growth and development. Growth and development. Right? Mostly these two terms, growth and development, they are used synonymously, right? But they are very different from each other. When we talk about growth, it essentially means increase in the number or increase in the size of cells. Increase in the number or increase in the size of cells. Whereas development is concerned with the maturation of function of cells. It means the maturation of function of cells. Typically, the CNS maturation, central nervous system maturation, right? So these two terms are very different. Growth, it deals with the quantitative aspect of the baby, quantitative growing aspect of the baby, right? Whereas development is the qualitative aspect, right? So now one by one we are going to discuss both of these, growth as well as development. We have learned that these two terms are very different from each other. One is the quantitative aspect whereas other is the qualitative aspect, right? Let's start the topic, growth. The first subtopic here is going to be the laws of growth. Whenever we talk about something in nature, there's going to be a law, right? So concerning growth, we have some law. Let's talk about the laws of growth. The first law here is that growth of every individual is unique. Growth of every individual is unique, right? I'm going to grow differently, you are going to grow differently, we all are very different, diverse, right? So this is the first law, that every individual is going to grow differently. Growth of every individual is unique to that person, right? The second law here is about the direction of growth. It says that the direction of growth is going to be cephalocaudal and distal to proximal. Let's write down the second law. It says that the growth direction, the direction of the growth is going to be cephalocaudal and distal to proximal. Distal to proximal. What do I mean by this? So for example, if this is the baby we are having, the growth is cephalocaudal, that means head to down, head to toe, and distal to proximal, that means in the individual limbs, hands and palms and soles, to the proximal limb, right? So if ever you have seen a very newborn baby, you can notice that the size of the head is comparatively bigger as compared to the body, right? And as the child grows, the body slowly, gradually assumes a bigger size, and finally our body is bigger than our head, right? So the direction of growth is going to be cephalocaudal in direction, and in the individual limbs it is going to be distal to proximal, right? The third law here is that this growth of different tissues in the body will have a different growth pattern, right? To explain this law, I'm going to draw now four curves I'm going to draw. Let's label it as graph A. This is graph B. Graph C. Lastly, this is graph D. The x-axis represents the age, right? So let us look down into each of these graphs. Firstly, let's talk about graph A. Can you notice in this graph, initially there is very rapid growth, right? Very rapid growth in the initial period of life, and thereafter little to no growth. There's a plateau, right? This represents our neural growth. Our neural growth. The majority of the development of our nervous system happens in the initial years of life, and thereafter there is little to no growth, right? So this represents our neural growth. Maximum growth is going to happen in the initial years of life. It is said that our brain size, our head size is actually 65% of the adult size at birth, and at the end of 2 years it reaches to approximately 90% of the adult size, right? So you can see how rapidly our brain develops, how rapidly our head develops, right? Now coming to graph B. Notice here, in the initial period there is rapid growth, then there is a plateau, then again there is a rapid growth, right? That means in the initial period the child will grow very fastly, then there will be a halt in the growth, then again there will be an upshoot. This represents nothing but somatic growth. Somatic growth. The sigmoid shaped curve is for the somatic growth, right? Our babies, they grow exponentially in the initial years. They doubles, triples very fast. Then there is going to be a plateau. Then as puberty hits, again growth spurt is going to be there. Now coming to C, graph C. You can notice here, initially there is little to no growth, absolutely no growth, a plateau, and suddenly there is an upshoot. This is the graph for sexual growth, right? As soon as the puberty hits, sexual growth is going to be there. Lastly, we have graph D, where what is happening? There is a peak in between, right? This peak is usually seen at 4 to 8 years. So in the initial period up to 4 years, there is no growth. In between 4 to 8 years, there is growth. And after 8 years also, there is no growth or regression, right? So this is nothing but the graph for lymphoid growth. Lymphoid growth. Our lymphoid tissue grows maximum in this period, and after that regresses, right? In this age only, the thymus would be very enlarged. You can palpate easily the lymph nodes in that baby, which is absolutely normal at this age, right? So we are done with the laws of growth in this video. Now the second topic here is going to be the periods of growth. Periods of growth of the baby. Depending on the age and the growth periods are given, right? So when we talk about the periods of growth, I can broadly divide them into prenatal, that is before the birth, postnatal, that is after the birth, and lastly adolescent group, adolescent period, right? Prenatal, that means inside the womb of the mother. What happens inside the womb? Firstly, an egg and sperm meet to form a zygote, right? Form a zygote. This zygote or fertilized egg is the term used till 2 weeks of life, till 2 weeks. After that, the baby is labeled as an embryo. Embryo is the term used from 2 to 8 weeks. E for embryo, E for 8. Then we have something which is known as a fetus. F for fetus. If you reverse this F, it becomes similar to 9, right? So fetus is 9 weeks onwards till birth, right? Now before going to the postnatal phase, I want to discuss about a term that is known as perinatal period. Perinatal period. This is a period that includes both prenatal phase as well as postnatal phase. That's why I want to discuss it here. This is known as perinatal period. Perinatal period is from 22 weeks to 7 days post birth. 7 days post birth. Right? Now coming to the postnatal phase. Now the baby is born. The newborn is known as a neonate. This term neonate we use till 28 days of life. For the first 28 days, you are going to label the child as a neonate. This is further divided into an early neonate and a late neonate. Early neonate is the first 7 days of life, and after that, 7 to 28 days is the late neonatal period. Now coming to infant. Infant is someone which is less than 1 year of age. Infancy includes the neonatal period as well. There comes the role of a term that is known as a post-neonate phase. Post-neonate phase. This is from 28 days to 1 year of life. 28 days to 1 year of life. After infancy, the child becomes a toddler. A toddler is 1 to 3 years. Then it's preschool age, which is 3 to 6 years. Then comes the school going child, that is 6 to 12 years. Now coming to adolescent phase. This adolescent phase, according to the new Ghai edition, is termed as 10 to 20 years of age. Further, it can be divided into early adolescence, mid adolescence, and late adolescence. Early is 10 to 13 years. Mid is 13 or 14 to 16 years. And lastly, it is 17 to 20 years of age. Remember, this adolescence is different from puberty. Puberty means appearance of the secondary sexual characters, whereas adolescent is the age group that is defined. Right? So it is very different from puberty. Puberty means attainment of the secondary sexual characters, whereas adolescence is the age group. This age group 10 to 20 years. Now, we have known the laws of the growth, the periods of this growth, how we classify the child, and lastly, we need to now assess this growth. Now discussing the parameters that you are going to use to assess the growth. So right now, there's going to be some parameters for growth assessment. Parameters for growth assessment. Now 3 kg for a newborn is normal, right? But I know 3 kg of a 1-year-old is not normal. That means weight is something that is going to be determined by my age, right? So there is going to be some age dependent parameters and some age independent parameters. So I can broadly divide these parameters into age dependent, and age independent parameters. Age dependent includes weight, height, head circumference, BMI, right? And age independent includes mid upper arm circumference and skin fold thickness. Furtherly, in the next section, individually we are going to dissect down into each of these parameters and how a normal child growth and when we are going to label it as abnormal. Thank you.